Good evening, I'm Mark Falanci. I'm the Chief of Police of Roxbury Township.
My name is Loretta Radlick. I'm the Superintendent of Schools here in Roxbury.
Hi, my name's Jim Craig. I'm the Public Health Nurse for Roxbury Township Health Department, and I've been working here since 2009.
I am Blanche Bonifacio, owner and CEO of Mary Hart Senior Care.
My name is Radwa Ali, and I am the Director of the Roxbury Public Library.
I'm Bob Hackett, Chief of the Roxbury Township Fire Department and Director of Roxbury Township Office of Emergency Management. With me is Brendan Dillon, Captain of Roxbury Company 2 Emergency Medical Service.
The biggest challenge happens when our residents and employees started getting sick.
The biggest challenge occurred during the spring of 2020 when New Jersey and New York were hit the hardest. We were among the first states to feel the full brunt of COVID-19, and the results were devastating.
When the COVID outbreak hit, no one had any idea of how to protect ourselves. There were no vaccines. People were being taken to the hospital.
When the virus first appeared, there was so much that we didn't know about transmission and prevention of exposure. The information we were receiving was changing daily, so we were constantly trying to adapt to our response procedures.
Nothing was certain during the height of the pandemic. Every day there was a new piece of information. One day you learned that you needed to do X, Y, and Z to keep yourself and your loved ones safe, and the next day it was something else. A public library is open to all. That's our defining and most wonderful feature. But all of a sudden, that wasn't so wonderful anymore. Before the shutdown, we had so much insecurity, worrying about the hundreds of people that came through our doors every day, from infants to the elderly. And then when we were told to close our doors, the new worry was, how do we continue to do our jobs? How does the library, an institution that's all about gatherings and community and connection, how do we continue our mission behind closed doors and when our staff is working from home?
Even at the height of the pandemic, I was shocked that the Department of Education allowed schools to go virtual. Teachers had never taught virtually before, and students had never learned through that platform. Parents had never played such a significant role in daily instruction.
It was difficult to get volunteers because they were worried about their own family members. A lot of family members had other members with compromised health.
One of our biggest challenges involved keeping up with case investigations, calling residents who had tested positive for COVID-19, and making sure they understood the importance of quarantining in order to minimize further spread. These interviews also involved getting a list of persons who had direct contact with a positive case prior to their onset of illness. Each direct contact had to be contacted and instructed to quarantine. One positive case could take up to 5 or 6 hours to complete if there was a large number of contacts to notify, and all the information regarding each case had to be reported to the New Jersey Department of Health. Our department worked on case investigations 7 days a week, often from 5 in the morning until 9 o'clock at night during the height of the pandemic.
Ultimately, the goal we had was to continue the same response to whatever call types we were receiving, and at the same time keep the officers healthy and protected to the best of our ability. Ultimately, the prevention of an outbreak within the department was our top priority, and along with the officers not taking the virus home to their families.
I think the greatest challenge we faced was the unknown and all of the emotions that go along with that. We were trying to focus on education while also trying to understand the impact of the virus.
Once we had a general understanding of the virus and how to do our job, the acquisition of the PPE became the most difficult. Initially, we could get what we needed, but that became difficult very quickly as everybody was trying to buy the same supplies.
Another challenge involved the shortage of personal protective equipment that was felt throughout the region. Mary Hart Nursing Home and Assisted Living were hit hard by this shortage. There was a huge interdepartmental effort throughout the township to alleviate this shortage by using all available resources and searching every nook and cranny for any forgotten stockpile.
I feel our officers are always going above and beyond to serve the community, and they're willing to do whatever they need to do, and the virus didn't change that. We just learned to adapt quickly to the changes that were thrown at us and still provide the great service to the community.
Since the beginning of the pandemic, our department has made every effort to make ourselves available to the community. We have literally provided assistance at all hours, day and night, answering questions and providing guidance. During our investigations, we have spoken with family members whose loved ones had passed from COVID. During these difficult calls, we provided compassion and comfort.
Actions were taken. Availability for video calls, Zoom and FaceTimes, making sure we have enough PPE, ensuring everyone follows the guidelines and precautions, and a constant monitoring by testing everyone. A COVID unit was created to be able to accommodate COVID patients and separate them from the rest of the residents. Our staff continuously providing not only the medical care, but the physical, emotional, spiritual, and psychological needs of our residents.
The library staff was extraordinary, and they still are. Basically overnight, we reinvented every aspect of what we do to make it work during the lockdown. Our children's librarians were churning out Zoom story times, science and art activities, and making take-home craft kits. For the older audience, we had a range of wellness sessions happening every day. Meditation, yoga. One of our staffers is a Zumba instructor. Well, now that was her main job for the library. From a budgeting perspective, the Library Board of Trustees gave us the leeway to make the adjustments necessary to get more ebooks into the hands of as most people as possible as quickly as possible. Staff were on the clock every single day, assigned to pick up the phone from home, answer questions online, and keep the library as open as it could possibly be. But what I'm most proud of is the initiative they showed. Somewhere early on, we decided to do something with the patron database that we have. Well, we sorted it by age and started calling people to ask how they were and if there was anything that they needed, besides books, which we happily delivered. From these conversations, we realized that what they needed the most was masks. This was when you couldn't even find fabric to buy. Through our contacts with friends, the Rotary Club, the Women's Club, the Chamber of Commerce, and many more, many of whom remain anonymous to this day, the library served as a clearinghouse for mask donations and distribution, and our staff personally delivered over 1,000 masks to Roxbury residents. At every twist of those harrowing months, everyone from the library showed up. Everyone asked what they could do to help, and everyone rolled up their sleeves to get it done. The Roxbury community could not have asked for a finer group of people to serve in their public library.
We were already a one-to-one district for the most part, and we had the right people in the right places to design plans, create schedules, recreate schedules, review COVID procedures, make personnel decisions, etc. Job responsibilities changed a bit for some populations, such as our bus drivers, who took on the responsibility of delivering meals, and administrators and nurses who took on the responsibility of contact tracing. For my part, I never expected to know our local health officials as well as I do, and they're great guys. To support our community, we have parent nights offered through our Sail Academy that provide a plethora of instruction and support from academic to social emotional. We also instituted a Saturday support program to aid students in forwarding their learning. Classes are small so that students can also feel emotionally supported. We make great use of our outdoor classroom at the Meeker Street Pavilion, and all of our sports, clubs, field trips, and performances are back as well.
Our department has been in constant communication with Roxbury PD, Mary Hart, schools, daycare centers, all of the township departments to ensure that every effort is being made to keep our residents safe. I personally feel that our town has performed very well during this crisis.
Now that we have survived the worst, we're still faced with challenges like making sure we have enough staffing and continuous training for our healthcare workers.
As far as challenges now, I think that we are currently in a good position. We have learned what works for us procedurally, and that's what we've been doing for the past year. A lot of the myths of the virus have been eliminated, and we now have factual understanding as to what we need to do to protect officers while they're serving the town.
We have returned to a more typical school day this school year, but we still have quarantining to contend with. Probably the most significant need right now is social-emotional support. We have seen a slight increase in inappropriate behaviors, which I'm certain stems from having dealt with anxiety and uncertainty for over a year. We are working with staff, students, and families to help everyone learn how to regulate emotions as we strive to return to a sense of security and normalcy.
One of our current challenges involves keeping the community vigilant against the virus when our residents, along with the rest of the country, are exhausted from COVID. Another challenge for us has been conveying to residents the importance of getting vaccinated. Although Morris County presently has the highest vaccination rate for COVID-19 of any county in the state, There are still too many residents that are unwilling to get vaccinated due to a variety of reasons, including misinformation and fear of the vaccine.
Roxbury and the whole community did not stop supporting us. To name a few, individuals and local churches, including school children, the Roxbury Women's Club, there's a local knitting club, the local farm, the Roxbury Police and Fire Department.
Overall, our residents have dealt with this pandemic responsibly by wearing masks, social distancing, and honoring quarantine. Due to these actions by members of our community, there have been fewer individuals that have become infected and fewer deaths.
The people of Roxbury Township were phenomenal throughout the entire pandemic. They were really extraordinary during the initial 3 to 4 months when the virus first appeared in our population. And the people of Roxbury followed these directions that they were given and the requests that were being made of them. I was involved in daily briefings given by the state police. The biggest concern expressed in those briefings from other chiefs was non-compliance by their residents. We never had a serious issue with non-compliance. Our residents did what was asked of them. I'm not saying they were necessarily happy about the restrictions, but they did what we asked of them in reference to those restrictions until we could sort out all of the information that we were getting concerning the best practices going forward. At the end of the day, the people of Roxbury did what they always do. They helped those who couldn't help themselves because they knew that it may be them that needs the help at some point in the future, or that they had received help like this themselves in the past. The people of Roxbury are a unique group in that it's a bigger town, but it has a small town feel. The residents should be commended as much as the first responders, because we couldn't have done it without them, without their willingness to do what we were asking of them.
The community has always been and continues to be extremely generous and supportive to Roxbury Social Services. During the pandemic, many residents gave generously. The amount of monetary donations that came in were astounding. So our community overflows with giving back.
Throughout the pandemic, I think the district did well in providing information and guidance, even though it was ever changing, to parents. And overall, the parents were patient and positive. I was truly impressed by the number of signs of affirmation and support that went up around the community. To continue on this positive path, the community continues to need to have faith in us. Collectively, we think positively with open, creative, innovative, and problem-solving minds. We consider all sides and aspects of a situation and rely on multiple data points to inform our decisions. I think overall, there has been mutual support and respect. It is a great district, a great community, and I'm honored to be part of it.
As with any other crisis, we are all in this together, and our strength is in our unity. The more we look out for each other's well-being, the stronger we are as a community.
Community, community, community. It's what we turn to celebrate a joyous occasion, and it's what we lean on when things take a bad turn. We all experienced a once-in-a-lifetime, horrible chain of events and consequences, but it was bearable because we did it together. All of the organizations represented tonight, and the many more groups and individuals out there who made a contribution in some way, no matter where we are born, no matter our political affiliation or who we voted for, no matter our socioeconomic status, our sports team, our gender, or who we love. We got through it because we put all of that aside for the one thing that ultimately mattered. We are a community. Roxbury is full to the brim with wonderful people who take this to heart, and that is why our community is stronger now than it ever was.